I hit 35 and all of a sudden everything went kaplow. You know, everything started falling apart. Let me think. I found out I had hypertension, I found out I had hypothyroidism, and you name it, and found out that I had diabetes on adult onset. And within 3 years, my diabetes had gone what they call brittle. And basically, the easiest way I can explain it is like being on a roller coaster. I would wake up in the morning in the beginning and it would be super, super low. By the middle of the day, it was dangerously high. So I'd have to take insulin and back and forth and back and forth. And I began stressing. And of course, you know, my answer to that stress was to eat, because I didn't know how to cope. And I didn't want to deal with me. So I ate. And I kept eating. And before you knew it, my diabetes was getting worse, and I was eating to console myself, which was making the diabetes worse, which was this vicious, horrific cycle that I would not wish on my worst enemy. But by the time, 10 years of that, and by the time I was 45, I was 270, 280 pounds at that point. I was absolutely miserable and still trying to exist. I don't call it living, because it was, what could I get done by 3 o'clock? Because by 3 o'clock I was exhausted. I couldn't go any further. I couldn't do anything else. I came here to Arkansas after a personal tragedy down in Florida. My spouse of 10 years died in a car accident. And of course, the depression added to everything else, and there I was eating again. And in 2009 I came here. And I got with Dr. Pittman, who was my personal care physician, my primary care physician, I'm sorry. And he kept trying everything. By the time we got to what I call my breaking point, I was taking 27 different pills a day. I was testing my blood sugar 5 times a day. I was taking insulin 5 times a day. The worst incident was I had a period of where I went into a comatose state, and I was in a comatose state for almost 21 days. It's either 20. My doctor told me at that point, you cannot keep doing this. Your body's not going to, you're not going to live through it. Well, here I have 4 adult sons and no grandchildren, and you're telling me I am 47 years old and I'm going to die. That did what nothing else could do. It kicked me in the rear. It did what nothing else could do. At that point, I became desperate. I was willing to do anything. And a friend of mine told me to look at the Baptist website. Kind of informational, but I wasn't really sure. So I called, and there were some individuals who were able to direct me to the informational seminars where I met Dr. Paul, who is, oh my God, the man should have wings. I promise you, he should have wings. The man is brilliant, and he's compassionate, and he's kind. And even in the seminar, he took the time to speak to not only myself, but all of the individuals. There were roughly about 15 or 20 of us there. And he took the time to answer some of the dumbest questions. And to him, there was no such thing. Mm-hmm. And he took the time to answer those questions. And he answered them in a way that even the worst layperson could understand what he was speaking of. And, you know, Leslie, oh my God, I can't say enough about her. 1,000,001 phone calls later, every question I could come up with, you know, was the cow going to jump over the moon, and was that going to cause, you know, an eclipse? And he was, I mean, I came up with some ridiculous scenarios because I was scared. And every time she would calm my fears, she would take my calls, no matter how crazy it sound like a lie. But when you're afraid and you don't know what's going to happen and you're fearful, to have people around you who are kind and they're confident, and that confidence shows, but it's not a cockiness and it's not arrogance. It's kind and considerate and professional and confident, and it's like, I'm going to be okay with these people. And that's how it made me feel, right? I mean, from the moment I made the decision, all the way through every pre-op procedure, through every test, every piece of paper, they were there. And I came in that morning to have my surgery, and unbelievably enough, at 5 o'clock in the morning, Leslie called me, and she asked me, was I okay? She didn't have to do that. you know, and it was just amazing, and it made me feel so much better. And I woke up and I was in recovery, and I wish I could remember all the names of the nurses and the technicians and the people who were in and out and back and forth, but there was not one member of that team that was inconsiderate or in kind or unprofessional in any way. And for me, having been in the healthcare profession, that is amazing. Patients were there, they had these little makeshift wax things. So I had because I'm a visual learner, showed me, and they talked to me. It's like, this is the size, this is what you're looking for, this is what you can do, this is what you can't do. Right down to giving me sample menus and showing me what to do. And you know what it feels like to think you're gonna die. And then all of a sudden, this group of people who does not know you from Adam House Cat, and they show up and they give you your life back. I can't explain that to anybody. I'm sorry. I can't explain that. You don't understand that I wasn't going to see my grandkids, that I don't even have yet. You know, I was never going to finish college, which I didn't decide to go back until I was 40. But all these things that I would never have done, you know, and I don't even have to go there. I don't take 5 shots every day anymore. I don't take 27 pills a day. I'm not scared to move. I don't see a flight of stairs and get scared. Oh God, I wish I could make you understand. I can't. I can't make you understand what it feels like. I was bankrupt. I was emotionally, physically, and with regards to my health, I was bankrupt. There was nowhere else to pull from. And all of a sudden, this group of people, the people here at Baptist Hospital, the people at Arkansas Surgical, they gave me my life back. And I will never be able to thank you all for that. I really won't. I'm sorry. If there's one message I can give to any person, is if you are honestly considering this, 3 things. 1, just do what they say. I mean, it's so easy. You lay it out like it's the sidewalk. All you gotta do is walk. It's just that simple, you know? But understand that if you don't change what's inside, I don't care what outside looks like, it's not gonna get any better. And I found that out for myself. And the best rule I learned, I got from Leslie, and she told me, and I'll give it to you, it's best advice I'd ever gotten. And that is, what you think about me is none of my business. You know, and I was so worried about what everybody else was going to say, what everybody else was going to think. And she was like, sweetie, what you think about me is none of my business. And that brings us to today. And I just got accepted to University of Arkansas Medical Sciences, the nursing program. I'll be finishing up my bachelor's in about 1.5 years. And I'm going to hope that I can like trot over here and maybe help somebody to see what the wonderful people here made me see. And if they are that good in every other department of this hospital, there's nowhere else to go. This is it.